I am presenting panic disorder. Panic disorder, according to the DSM-5, is an anxiety disorder that results in recurrent and unexpected panic attacks. Panic attacks are classified into two categories, expected and unexpected. Expected attacks are generally triggered by something that the person is aware of, such as an encounter with something the person fears. Unexpected panic attacks are random. The person does not know why the attack is caused, and there are no definitive causes of panic disorder. However, psychologists do believe there may be several risk factors that contribute to the disorder. Family history is important when diagnosing panic disorder because oftentimes mental illness runs in families, and it is important to establish if there could be an underlying cause of the disorder. Brain disorders, such as overactivity in the basal ganglia, located deep inside the cerebral cortex, have been associated with panic disorder. Substance use is another cause of panic disorder. The withdrawal symptoms trigger anxiety, which can result in successive panic attacks, causing panic disorder. And stress. We're all well aware of what stress is, and it plays a really large role in panic attacks. Panic disorder statistics. There's 6 million adults suffer from panic disorder in the United States. Most of them are women. And that means a pretty large variety of people have panic disorder or have been diagnosed with it. And there's such a large population that has an anxiety disorder that the government has allocated $42 billion to treating the disorder. The pathophysiology of panic disorder is not really known. They just know that it affects the autonomic nervous system, which causes hypersensitivity, increased arousal, and chemical imbalances. And the signs and symptoms of panic disorder. So sudden repeated attacks of fear, a feeling of being out of control during a panic attack, an intense worry about when the next panic attack will happen, fear or avoidance of places where panic attacks have occurred in the past, and the most notable things are the physical symptoms during an attack, which would be a pounding heart, sweating, breathing problems, weakness or dizziness, feeling hot or cold, tingling or numbing hands, and chest or stomach pains. And then on the left side of the screen, we have this face that shows all of the symptoms of somebody having a panic attack. During a panic attack, they wrote this in the face silhouette and showed what it was like while they were in the process of having a panic attack, because they do have panic disorder. And then risk factors for getting panic disorder or already having an anxiety disorder like generalized anxiety, depression, or bipolar disorder. If there is a history of sexual or physical abuse during childhood, that can trigger panic disorder later in life. Smoking, that's bad for every disease, it seems. Respiratory problems can trigger panic disorder because we can't breathe. It's scary. So people that have asthma or COPD often find that they do have respiratory problems. And then there's high sensitivities to anxious situations. So that would probably correlate best with PTSD, where if you're in a stressful situation, you can't handle it, it will trigger your anxiety. And that's how that works for high sensitivities. And then significant stressors. It could be somebody dying, that would stress somebody out and cause panic attacks because they don't know how their life is going to exist without that person. And then an assessment of panic disorder. Panic disorder is recurrent. Panic attacks are not triggered by anything. The panic attacks happen for a month or more and coincide with the worry of more panic attacks happening. Panic disorder often prompts an individual to stay away from places they have had previous panic attacks, which results in the person becoming agoraphobic. Agoraphobic is when basically the person doesn't want to leave their house because everything outside of their home triggers a panic attack, or they believe that it does. The quality of life decreases because you feel like you can't do anything. Patients may resort to substance abuse to try to calm the panic attacks on their own, and patients may also attempt to unalive themselves. Treatment: psychotherapy, medication, cognitive behavior therapy, mindfulness, and exercise. Some of the prescription medicines prescribed for panic disorder are SSRIs and SNRIs, and then benzodiazepines. And the benzodiazepines are not given out very often. That would be things like Ativan and Valium, stuff like that, because they're addictive, and obviously you don't want the patient to become addicted to stuff when there's already an increased risk of that happening due to the disorder. Exposure therapy would be from people that are constantly in fear of stuff that causes them to have a panic attack, so getting exposed to those would lessen the odds of having a panic attack. And then we have lifestyle changes like meditating, avoiding caffeine, alcohol, and nicotine, stress management, and joining support groups. References. That's it. Thank you.